Welcome back to the Gee Ursula Show. Thank you so much for hanging out with us on this Tuesday morning. Our state is inching closer and closer to being 70% vaccinated, but if you haven't gotten your second shot or received the single-dose Johnson & Johnson vaccine, you may want to get another shot soon.
The Delta variant is now taking hold in the U.S., 10% of new cases now and doubling every 2 weeks. It's the most contagious variant yet, even infecting those who are partially vaccinated.
And doctors say that Delta variant isn't only more contagious.
The scary part of that also is if we look at India and China, the folks who have the Delta variant are actually sicker. They're higher risk of getting ICU admissions and a higher risk of death.
So we need to get more information about this Delta variant that is ravaging India and whether you will need a booster shot. And joining us now is our favorite virologist, Dr. Angela Rasmussen. Good morning, doctor.
Good morning, Ursula.
Thank you so much for joining us. So tell us about this new Delta variant. I know I was following your Twitter feed yesterday and you were tweeting quite a bit about it. What do we need to know?
Yeah, so the main thing that people really should know about the Delta variant is that, to me, as a virologist, this is probably the most concerning variant that has emerged so far. But what people really should know about it is that we do have a solution for it, and that is that full vaccination, a complete regimen of your vaccine shots, is very, very protective against the Delta variant, over 90% protective. So people really should know, first and foremost, if you're worried about the Delta variant or just in general, and you haven't been fully vaccinated yet, you should go out and get your vaccine and make sure that you complete the vaccine regimen. But what people should also know about the Delta variant is that, as you said, it is more transmissible, which means if you're around somebody who is infected with it, you are more likely to be infected with it yourself if you're not vaccinated. It also, unfortunately, is pretty good at infecting people who have only been partially vaccinated. They do have a little more protection against it than people who are unvaccinated, but it still poses a great risk to people who are only partially vaccinated if they've only gotten their first shot. So that's why, again, it's really important that people do go out and complete their vaccination regimens to make sure that they are as protected as possible from this. Now, one thing that's less clear to me, it's definitely more transmissible, but it's less clear to me that it's actually more pathogenic. Now, you mentioned that in India, they have observed that people with this variant are more likely to be put into the ICU, but I think that it's really still, the jury is out on that in terms of what were those people's pre-existing risk factors. There's not a lot of people in India. A very small proportion of the population has actually been vaccinated. So people there are going to be more susceptible. And that could potentially explain why that risk of hospitalization and ICU admission is higher. But the key message to take home is don't get the Delta variant. Take precautions if you're not fully vaccinated and get fully vaccinated as soon as you possibly can.
Dr. Rasmussen, you mentioned, I heard you say 2 doses. And what does that mean for Johnson & Johnson?
So this is something that I have a lot of questions about, given that I myself had the Johnson & Johnson vaccine. We don't have a lot of data on how protective the Johnson & Johnson vaccine is against the Delta variant. My concern, not that the Johnson & Johnson vaccine isn't going to protect you against severe disease. We already know that Johnson & Johnson does protect people very well against severe disease, and there's no reason why it wouldn't against the Delta variant. My concern is whether or not you would be more susceptible to breakthrough infections, being that there is not a booster shot. Now, one of the things that the booster shots do in terms of your immune system is they basically just give your immune system, the cells of your immune system, the B cells that make antibodies, a reminder of what they are looking out for. And so those antibodies that they make can basically be even better. They can be even more neutralizing and capable of rendering the virus non-infectious. There's no second shot with the Johnson & Johnson. So my question, and this is really a question to the NIH and to our public health officials, is it time to think about recommending a booster shot of an mRNA vaccine for people who've gotten Johnson & Johnson, to reduce their risk of being infected with it or having a breakthrough infection even further.
Real quick, from the start, from the get-go, and I don't know if you addressed this in your answer right there, but from the very beginning, we all knew or we have seen that Johnson & Johnson, the effective rate was at I think late 60-something%. It wasn't even 70 or 80%. Is that correct?
Yeah, so that's correct. But it's really important also when you're talking about that number to recognize that these clinical trials were done in different ways. And Johnson & Johnson looked at symptomatic COVID-19, but it also looked at severe symptomatic COVID-19, whereas Pfizer and Moderna just looked at symptomatic COVID-19 overall. So while Johnson & Johnson was 60% efficacious in the trial at preventing all symptomatic COVID-19, including mild, it was very, very effective, right on the same level as Moderna and Pfizer at preventing severe COVID-19, which early on was definitely what we needed. We need to keep people out of the hospital. We need to keep people from dying. But now that we're still looking at spread, and there are many places in the U.S. where people are still not vaccinated, we also need to be thinking about protecting people against infection, and a booster could potentially improve that.
Dr. Rasmussen, I've got to say, and I'm just going to make a comment, but I have a very important question I need to ask too. Just listening to what you said about Johnson & Johnson, knowing the issues that Johnson & Johnson had with the blood clots, and then some of the other issues in production, and then now we might need a booster. That sounds to me like a lot of reasons for people to think twice, in particular when dealing with that particular vaccine. Okay, and that's just a comment, but I have to ask you about this other thing, which is important. The CDC scheduled an emergency meeting last week to take another look at myocarditis in children, and specifically, are there any links to these heart issues that more than 200 cases now have been reported, and if there is a link to the vaccine? From your perspective, and you are a virologist, but from your perspective, how do you assure parents, or can you, when you're looking at whether you vaccine your children or not, and you hear about these heart issues?
Yeah, well, so two things. First, to address your prior comments, I still don't regret getting Johnson & Johnson. I'm very glad to have gotten this vaccine. It's going to be really helpful for a lot of other people who can't necessarily make it to two vaccine appointments. So just addressing that, I think that there's still a place in the landscape for Johnson & Johnson. It is a very good vaccine. But in terms of reassuring parents about the myocarditis issues, I would just say that, all drugs, all vaccines do have side effects. The reason why the ACIP is having an emergency meeting is to try and understand whether that is caused by the vaccine and how dangerous it is. Because myocarditis sounds scary because it's the heart, and it's a very medical, clinical term.
Yes.
But it's certainly not even necessarily something that's going to cause long-term illness, much less severe illness. So I think people just, they should acknowledge that these kind of things do happen with any drug, with any vaccine. It's all about a risk-benefit analysis, and to just try to be patient until we know a little bit more about it and what the risk is to children. Now, the risk of myocarditis might be minor for kids, and as far as I know, no kids have died. No kids have even gotten severely ill, as far as I'm aware. I could be wrong about that, but it's a low risk, even if it is caused by the vaccine. The risk to kids from having COVID is potentially low, but the risk of long COVID appears to be higher than we thought it was. And the risk to children is not non-existent. Children have died from COVID-19. So it's going to be about a risk-benefit analysis. And for now, I would not recommend anything different. If I had children who were ages 12 to 15, I would still get them vaccinated.
Appreciate your time. Thank you so much. And I ask you this because these are the questions that we are getting from our listeners, or some of the sentiments too that we often get. And so I just wanted to bring those to you because I knew you'd be able to answer them. Thank you, Dr. Rasmussen. We appreciate your time.
It's always a pleasure, Ursula. Take care.
Tell Taz hello.
You get